Hi everybody, my name is Rietta and I'm an application specialist with Spark. Today we are going to be discussing microneedling for hair and scalp treatments. To start, we always make sure our area is well prepped. Here you see our handpiece is wrapped with the silicone the barrier film, and our cord cover is on. Everything's been sanitized. Our needle has cartridges has already been inserted. And we always make sure that we have a barrier film on our device. We're going to start with our ampules. There's two different types of ampules, one for the scalp and one for hair improvement. And in both of them are cocktails, mostly comprising of vitamins, hyaluronic acid, and DHT blockers like saw pomelo and clary sage, etc. Herbal compounds that really benefit the scalp and help to increase blood flow to the follicles and help improve hair quality and scalp quality. When they come in a glass ampule, you snap the ampule off. We normally use what they call a pipette, which is a little device like this to extract the cocktail and put it onto the scalp. Nor when we're doing these kind of treatments, anytime we're doing any kind of microneedling treatments actually, and you're administering a cocktail, you always make sure that your needle depth is quite shallow. For hair growth, we're doing it at 0.5 millimeter into the tissue, and that's it. We are not looking for blood or anything like that. This is more like an infusion, and it's going to infuse those amazing cocktails into the scalp, and we're going to end up with better quality hair. What to expect? Hair grows very slowly, and so normally you might be looking at a real improvement probably in about a month. It takes a while for those improved quality hair follicles to start growing. It grows from the scalp up, obviously, and if you're doing gentlemen for hair improvement, typically we're doing that every week to every 2 weeks. It really depends on their needs. If you're doing women, even if you were doing it every 6 weeks, going alongside your regular facial treatments, they're still going to have better quality hair. With women, you're not, unless they have a real severe condition and you just want nicer hair, you could do them further apart and less often. With men, you're going to have a bigger job ahead of you, so you're going to be doing those treatments more frequently and over a longer duration. Of course, because this is our own natural process that we're sort of fighting against, gentlemen would normally have these treatments done annually to really make sure that the follicle is healthy and still productive. When we're doing the treatments, we're having everything covered. We make sure we have a barrier film, the handpiece is covered. We set our handpiece to 0.5 and we're ready to go. When I'm doing the treatments, I typically wear a mask on my face as well. So we are going to use our scalp treatment. It's the skin rejuvenation with vitamins. We're going to start with that today. And in order to open this, I usually use material like this, maybe some gauze or some cloth, because this is glass and we don't want to cut ourselves. And you're just going to snap the top of the ampule off like this, and we're ready to go. To administer the product, we're going to use a pipette to suck this out so we can drop it onto the scalp while we're doing our treatments. And I usually have a little cup like this, so if I have to put my product down, I can have a place to rest without spilling it. To do the treatment, I typically just use a spray alcohol. Now, Sue has freshly shampooed hair, so we have a really clean area to treat to begin with, and I spray liberally alcohol on the area that I'm going to be treating, and typically that's just the crown. We do not usually do the treatments on the sides of the hair because that is not an area that is so susceptible to DHT miniaturization. So we're normally just doing the crown. She has lovely hair, so she isn't in need, but this is a good example to show you how we can do the treatments without getting the hair tangled into the needles. So I like to keep the hair quite wet with alcohol, and I'm gauzing it through, and that does two things. It's going to be lowering the bacterial load, so we have a nice clean area to needle or to infuse, and it's also making the hair wet, so it's easier to part and to get the serum onto the scalp. If you don't do that and you're administering the serum, it's going to absorb into the hair itself and not into the scalp, it's the scalp we're trying to treat. The hair is already just keratinized product that doesn't absorb and doesn't grow. So we're just going to get this nice and wet. Another tool that we often use during these treatments, sometimes I do, if it's a gentleman I don't necessarily need it, is I'll get a metal comb end like this that can be sanitized, and I can actually part the hair with this. I'm not typically using the comb portion, I'm just using this to part. I don't care about combing the hair through, so I can just make parts like this when I am doing my needling. So I'm just going to start up here on the crown. I'm going to be working around this area so you have a good idea how to do the treatment. And you're just working each little section. Until all of your serum is gone. I like to travel quite a bit when I'm doing the scalp as well, because if you stay in one area too long, it does not feel comfortable. So I am just traveling quite a bit. The more sensitive areas of the scalp is always the front of the hair. So keep that in mind. Back here, it's not as uncomfortable as the front. And you just keep on going back segment to segment until the whole crown is done. And even though she has really nice, long, thick hair, my needles are not catching in the hair at all, actually. A lot of people think that just because you're doing circular motions, etc., that it'll catch, and it does not. And you just continue until your serum is finished. So she's done her treatment, and when she goes home, she has an option. If you're working on a gentleman that has like more advanced hair loss, etc., we have home care. It's a hair lotion that they can apply every night. It's an ampuled dropper that they can apply, just a few drops, and work it into their crown. And about every second day to two to three times a week, they can use our home roller on a clean scalp at night and just sort of irrigate the scalp with the roller. It's only a cup to, and apply the lotion, so it's going to have increase the efficacy of the lotion. And again, the lotion is another cocktail of DHT blockers. So for gentlemen, it's really recommended, and some women really recommended to use the home lotion as a continuance of their treatment to have better quality hair and better rooting of the follicles. Immediately after the treatment, you should avoid like doing scrubbing the scalp, avoid really hot showers, etc. Typically, you can take a shower, just make sure it's not too hot. Just don't shampoo your hair the next day. And I'm just usually really gentle with the scalp over the next few days afterwards. If you want to shampoo, you can just shampoo the rest of your hair and just don't do a scalp scrub. That's after 24 hours. If you're coloring your hair, always be very cautious, because you should probably avoid any kind of dyes on your hair for, I would say, a good 5 to 7 days before treatment, and probably 10 days after. So most people are coloring their hair every 4 to 6 weeks. I would probably suggest to have the treatments done in that window in between hair coloring. And of course, if you're not dyeing your hair, you have no restrictions whatsoever when you can have the treatment done. And other than that, you're going to have a really good quality hair. Typically for gentlemen, they're seeing a nice result after about 4 to 6 treatments. With women, I've seen women just even after 1 treatment. That being said, like a month or so afterwards, having a really nice result. So results vary. It really depends on what's causing the hair reduction to begin with. For any more questions or for contraindications, please refer back to your training guide. The contraindications for hair needling would be the very same as for skin, blood thinners, and any kind of interfering medicines, etc., pharmaceuticals. And talk to your local trainer if you have any questions. Talk to you soon.